homemade burgers and brews, and according to the government rule, they're supposed to close for eat in, but taking out is okay. You can see that to go parking only. We are not supposed to eat in, and parking to go is only, and the coming out available. The subject of this talk is about the current situation of a coronavirus, and the subject is very important in terms of the human life and the economy, and I'd like to provide some unconventional view. And with these unconventional views, many of you probably thought that's not acceptable, but take your time to think very carefully the evidence and the data presented. And I think that's an unconventional angle to look at the current situation. The title is Trump, Stop Shooting Yourself in the Foot. And I respect Donald Trump. He is one of the best presidents we had. But he is also a human, and as a human and has weakness. And I'd like to address this issue. I'd like to first discuss the freedom of speech. The First Amendment guaranteed freedom of speech and freedom of press. I hope my right for freedom of speech is respected. In terms of academic freedom, I'd like to mention American Association of University Professors had the policy college and university teachers are citizens, members of a learned profession, and officers of an educational institution. When they speak or write as citizens, they should be free from institutional censorship or discipline. But their special position in the community imposes special obligations. After India locked out the entire country, human experienced a situation never experienced in human history. More people are now in lockdown than were alive during the World War II. President Trump was concerned about economy. We can see that he tried to get this country back to normal situation as much as it can. Today is Easter. Let's recall what he said in terms of the open up by Easter.
My question is, you have two doctors on stage with you. Have either of them told you that's a realistic timeline?
I think we're looking at a timeline. We're discussing it. We had a very good meeting today. If you add it all up, that's probably 9 days plus another 2.5 weeks. It's a period of time that's longer than the original 2 weeks. So we're going to look at it. We'll only do it if it's good, and maybe we do sections of the country. We do large sections of the country. They could be.
Now look back what happened in China. In late December 2019, the Wuhan CDC detected cases. December 31st, 2019, the Wuhan Municipal Health Commissions released briefings on the outbreak of the virus. January 3rd this year, China began to inform U.S. government. On the 7th, Xi Jinping made instructions. And on the 20th of the same month, Xi Jinping made more instructions. January the 22nd, Wuhan was locked down. That's a population 46 million. Because of the tremendous damage to the economy and human life, some people already raised issue of the origin of the virus. The virus is still not clear. Representative Harry Ronda said if we were not tested, we do not know what they had. The CDC director, Robert Redfield, said correct. Ronda said again, if somebody dies from influenza, do we impose post-mortem testing to see whether they were from influenza or coronavirus? Redfield said there is a surveillance system of deaths from pneumonia that CDC has. This is not in every city, every state, or every hospital.
One of the issues, too, in helping address this is the fact that we do not have enough test kits. We know that many individuals, as my fellow member to the right of me, Mr. Raskin, pointed out, there are individuals who have requested test kits and have not been able to access them. My understanding is as late as last Saturday, ground zero in King County, Washington, that the healthcare professionals from that facility still did not have access to test kits. Mr. Redfield, do you know if that is true or not?
We have provided test kits to the health department. The University of Washington has developed their own tests.
Were those test kits available last Friday?
Yes, sir.
Thank you. And without test kits, is it possible that those that have been susceptible to influenza might have been miscategorized as to what they actually had, that it's quite possible that they actually had COVID-19?
The standard practice is the first thing you do is test for influenza. So if they had influenza, they would be positive for...
But only if they were tested. So if they weren't tested, we don't know what they had.
Correct.
Okay. And if somebody dies from influenza, are we doing post-mortem testing to see whether it was influenza or whether it was COVID-19?
There is a surveillance system of death from pneumonia that the CDC has. It's not in every city, every state, every hospital.
So we could have people in the United States dying for what appears to be influenza when, in fact, it could be the coronavirus or COVID-19.
Some cases have been actually diagnosed that way in the United States today.
The origin of the virus is still not clear. I understand that there are criticisms on the way that Chinese government handled the viruses, and I think something the next and even United States government also can do better. And I'm not really supporting everything Chinese government has been doing, but I like to present the data to provide a perspective from history. Now look at the perspective of the entire situation of the casualties and the deaths in the United States. Overall, the flu death rate is low. The heart disease death is around 600,000 in 2017. Deaths caused by cancer, about 600,000. Unintentional injuries, around 200,000. And deaths from flu and pneumonia is only number 8 cause, around 50,000. And the motor vehicle fatality rate is about 37,000. And I do not know that number because it was not even in the top 10 reasons for US deaths. But even we know we have a lot of deaths every year, we still drive. Why? Because we are getting used to it, and we cannot imagine that if we don't drive, what our life will be look like. The flu pneumonia deaths, think about it. If we do something like we have been doing, is that reasonable and prudent to affect our human life and economy to that great degree? Is that reasonable to spend our attention and resource on something that even more significant. Now we have a very drastic public intervention since World Health Organization announced pandemic of the virus. The paper by Hatchett at Proceeding of National Academy of Science about the pandemic flu virus in 1918, there are two cities compared. One is Philadelphia, which did not do tangible public intervention. Another city is St. Louis, which did drastic intervention, blocked business travels, and similar to what we have been doing. But the overall deaths was only about 20% difference. And compared the leading cause of death and whether this 20% is what we have been doing right now. And that's a figure plotted in that paper. The cumulative deaths are very similar. The major difference is that Philadelphia has a peak, and then the death rate reduced. But St. Louis gradually raised, and the transmission will reach a peak which is lower, but the cumulative deaths is only 20% lower. So let's consider many people called unprecedented peacetime tragedy. And flu pandemic happened many times in human history. This tragedy never happened in human history. There are many deep reasons, and I will do some analysis on that. The scale of damage is worse than Pearl Harbor attack plus 9/11 attack in terms of the deaths and also the effect on the economy. President Trump said that it's an invisible enemy. But is that an enemy that should be dealt with this way? A visible enemy, in fact, is our own government. I'm not saying that government intend to cause harm, all right? I mean, the enemy is really within our brains. Our governments shot themselves in the foot. Why government interventions of these scales are bad? I'm not saying that the government should not issue advisories about how you should wear about the situation and try to refrain from travels, and you should wear facial masks and gloves, washing hands like that. What I'm talking about is locking down business and ban travels. Look at the history. From China to US and many other places, and Chinese government, I think, overreacted to the cases. And many people said that, oh, they did not act fast enough. They could have acted faster. But the lockdown of the cities in a very strict fashion caused the panic. And the US government heard from China, because the news from China is very scary, and every country get aware of that situation. Attention was directed to these issues for long, and the US government also overreacted. And why? Let's look at deeper reasons. I'm not saying that Chinese government intentionally overreact and the US government intentionally overreact. And I'd like to look at more deep reasons in terms of the psychology, brain science. We have intrinsic weakness of our brains. It's attention directed. Because we had prior case of China SARS and China overreacted, and there are so many different reasons. They've realized that probably should have reacted earlier, but for many well-known reasons they didn't. Then the overreaction caused the world to be concerned. That attention was tuned to that event for very long and caused panic. And supporting staffers, those in China and also in the White House, everybody has the book to write. Basically, every day they have routine things to carry out. So they are lazy in the sense that what they should do and provide a global view. But they don't, because everybody is just like a nuts in a machine, and machines start to crank, and out of control. And our president and the top leaders, they make easy decisions because they thought, although they are aware of the impact on the economy, on the human life, and many people can lose jobs, and they make easy decisions because those easy decisions will not be blamed by the press and the people that don't know the global view. And most people don't. They just demand you do something about it. And there is also insensitivity to scientific data and brain sciences. The paper that I was mentioning in the previous slide was probably read by some experts, but was misinterpreted. They did not state that overall difference is minor, 20%. No, they just state that you will slow down the peak and make it longer and lower so that our government can have more resource to handle the outbreak of the cases. But they did not realize that when government reacted in a bad fashion, then what it was supposed to help will cause much larger scale and more severe damage for many more people. And there is also a fragmentation of scientific discipline. Those people that are supposed to be expert, they did not know brain science. They did not really know sufficiently the attention from the society and the pressure from the up level of the government makes them really short-sighted. And there are few global experts that really look at the global view in terms of the annual deaths, the leading cause. They just blow the coronavirus situation out of proportion. Now, then you ask how to fix it. I think that it's a little bit too late. It is a little bit too late, but we still need to fix it before even later fix. Open up the locked world immediately without any conditions, because we do not have the resource and time to test everybody or even 50% of people. No, we don't have kind of resource. Even we test them, there's no clear criterion in terms of whether you're affected or you're not affected. You have resistance or you don't. And we don't have this kind of time. Flu viruses will be here to stay, just like other strains of the virus. They have been here with humans for many years, and the human body has its immune system to resist. Death rates are too low compared to other death rates, and we need to have a global picture, and we need to decide how to spend our resources. The second is that we need to look back for the root causes of this damage. We need to enact laws to forbid any governments to close any legal business during peacetime. Right now, we are in a peacetime, and the government is doing damage in the way that enemies with armed force cannot make. We need to require all government advisors to pass brain mind programs to learn brain science and psychology. I understand that in the Congress and the Senate, there is resistance to fund psychological studies even. They thought that they know better than psychologists. That's short-sighted. And such as the program in the Brain Mind Institute, there are many programs in the world about brain science, psychology, but they are too narrow. They are either concentrated on the traditional views and not on the computational views, and those who model computational mechanisms are very, very narrow. And the BMI is the unique place in the world that has both breadth and depth. And I encourage government to look into future of running the very complex society like the United States. Thank you very much for your attention. This talk will be available on the YouTube, and I encourage you to provide comments so that people can discuss these very important issues. And I'm only just one of the weak voices, and I'd like to see more people discuss these issues. I'm not saying that what I said is absolutely correct, but I'd like to provide another view as an alternative to many, many views you already have heard. Thank you very much.